Hi, Lindsay. I'm Devin.
Hello.
I'll be the nurse doing your assessment today. We're going to be doing a cardiovascular and pulmonary assessment. So I'm just going to be looking at your chest, your thoracic cavity, your lungs, listening to your heart, and maybe feeling some pulses. So,
Okay.
Do you have any questions for me?
Nope.
Okay. Well then, let's go ahead and get started. The first thing that I'm going to do is I'm just looking at your chest, looking at your thoracic cavity, your shoulders, making sure everything is symmetrical, looking for any concaving or convexing, looking, I don't see a barrel chest, anything like that, so we look good there. The next thing I'm going to do is I'm just going to palpate your chest. I'm feeling for any air pockets or air trapping. I don't feel any masses. Do you have any tenderness?
Mm-mm.
Also, when I'm looking at your overall appearance, I'm looking for any signs of respiratory distress or trouble breathing. Do you feel like you have any difficulty breathing? Okay.
Nope.
I don't see any signs of any respiratory distress. So that's good. The next thing I'm going to be feeling for is something called tactile phrenitis. So what I'm going to do is I'm just going to place my hands on your chest, and every time I do, I want you to say 99.
Okay.
I'm just feeling the vibration that I feel through my hand whenever you say the word, or when you say 99. So
99. 99. 99. 99. 99. 99.
okay. Good. So the next thing I'm going to do is I'm going to listen to your breath sounds, and then I'll do a couple of tests with that as well. Just take some deep breaths for me. All of your breath sounds sound clear and equal bilaterally, so that's what we like. We want them to be the same on both sides, so all of that sounds good. I didn't hear any crackles, bronchi, wheezing, anything like that, so that's all normal. The next thing I'm going to do is called a whispered pectorology test. So I'm just going to have you whisper a phrase such as 1, 2, 3, and then I'm going to be listening with my stethoscope, and I should be able to see that you're saying it with your lips, but I shouldn't be able to hear you.
Okay.
So just every time I say, every time you feel my stethoscope move to a new place, whisper 1, 2, 3 for me.
1, 2, 3.
You whisper. Okay, good. The next thing I'm doing is a bronchophony. So with this one, I'm going to have you say 99. And I should be able to hear that you're saying something, but it shouldn't be very clear to me through my stethoscope. So I want you to just say it normally, and then what I hear should be more of a muffled sound.
Okay.
But it's just, I'm going to place it in the same, my stethoscope in the same places again. This time just say 99 regularly.
99. 99. 99. 99. 99. 99.
Good. And then the last thing that I'm going to check for is an egophony. I'm just going to have you say E, and I should hear exactly what you say. So if you say E, I should hear that back. If I hear something, if I were to hear an A sound, then we would be concerned about consolidation in your lungs. So I want to hear just a nice E sound. So once again, just every time I touch.
E. 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 E.
Okay, good. The next thing I'm going to be doing is I'm going to just be listening to your heart sounds. So whenever I'm listening to these, I'm going to listen in 4 different places. I'm going to listen at your valves, and I'm going to count your pulse. What I'm looking for when I'm listening here, I'm looking for that I can hear your heart beating for one, and then I'm listening for additional heart tones or abnormal heart tones, such as murmurs and stuff like that. And you might notice when I'm doing this, I'm going to listen with both sides of my stethoscope. So, okay, so the first spot I'm going to listen to your heart is at your right sternal border at the second and third intercostal space. This is going to be your aortic valve. Then I'm going to move right across to the left side at your second and third intercostal space. This is your pulmonic valve. Then I'm going to move down to your tricuspid valve. Then lastly, I'm going to move to your midclavicular line at your fifth intercostal space. This is the apex of your heart, and it's the mitral valve. Here I'm going to listen for a pulse. Got an apical pulse of 82 beats per minute. I'm going to go ahead and I'm going to feel your carotid artery. Feel for the pulse in the carotid artery, and then we'll move on to the breast sounds in your posterior, your back. Okay. I'm just palpating lightly on the carotid artery, feeling for that pulse, making sure I don't feel any thrills. Then I'm going to listen, just make sure I don't hear any bruise. Okay, good. If I could go ahead and have you turn just a little bit, angle that way so I can get to your back. Okay, once again, I'm just examining the back, making sure it's symmetrical, palpating. Everything looks and feels symmetrical. I don't feel any masses, any tenderness present. Okay, so once again, I'm going to check for that tactile firmitis. So whenever I say 99, or when you feel my hand, just say 99.
Okay. 99. 99. 99. 99. 99. 99.
Okay. Then I'm going to go ahead and just listen to your breath sounds, and then we'll perform those 3 tests. And then that will conclude our exam. So just take some deep breaths for me. Listening in your intercostal spaces. And again, I'm just listening. We want clear and equal breath sounds bilaterally, which is what I heard. So that's all normal and that's all good. So we'll go ahead and do the whispered pectoraliloquy. This is the one where you're going to whisper 1, 2, 3, and I'm just going to listen to see if I hear it. Okay. The next one is the bronchophony. This is the one where you're going to say 99 again.
99, 99, 99, 99.
Okay, and then our last ones are egophony. This is the one where you're going to say E, and that's exactly what I should hear. We're checking that there's no consolidation in the lungs for this one.
E, 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 E.
And then that concludes our exam for today, unless you have any questions. Do you have any questions?
I don't think so.
Okay.
Thank you.